everyone, I'm going to take this off. I'm going to talk about masks today, and I'm not going to talk about the efficacy of masks or anything like that, but I'm going to talk to you about how to reduce some of the unintended consequences of wearing a mask. So a lot of people are wearing masks for work now, including myself, teachers, healthcare workers. If you work in a restaurant or in a supermarket, you're going to be wearing a mask. So what I've been noticing in my patients is that they've been complaining of headaches, neck pain, and a lot of that is due to the way you have to flex your head forward when you're wearing a mask, and I'll show you. So when you put on a mask, you can't see beyond the mask. So when I put this on, I have to tip my head forward a lot more, right, to see down. I can see to about here, but in order to see past that, I'm going to tip my head forward. So what that's doing is it's going to stress this upper cervical area right here. This is called the cervical spine in your neck, and it's going to also stress the neck muscles and can cause what we call subluxations or misalignments of the spine, mainly this upper cervical, but also in here, because as you flex your head forward, you're reducing your neck curve. And a neck curve is important for the stability of the spine, and also it protects that spinal cord. So as you reduce your neck curve, you're going to put more stress on the spinal cord. As well as, like I said, the muscles in the back of the neck here, which are called your suboccipital muscles, they get stretched and strained. So there's a few things that we can do. For sure, come in and get adjusted if you're having any of these symptoms, and especially if you're having to wear a mask all day, like myself. I know in the beginning, when I had to wear a mask all day, I started to get headaches literally as soon as I put my mask on. And as I started to get adjusted more regularly, they started to go away, and my body also adapted to wearing the mask. So there's that. Chiropractic can help. Another thing is using this. This is my new neck wedge. It's a little bit more intense than the other one, a little bit more firm. But this you can use to promote the neck curve. And I have another video telling you how to use this properly at home. But this is going to reverse that all day looking forward. So the other things I was teaching, like my staff members, was how to adapt your positions and your ergonomics while you're wearing this mask. So what I've done is try not to look down as much. I've taught myself to do things by looking straight ahead instead of flexing my head forward. If you're on a desk and you are typing and wearing the mask, you're going to have to learn how to not look at those keys. I was just educating a patient today that she's just going to have to learn. It's like when you were a kid learning how to keyboard, like I did. They put this little box over our fingers. So in much the same way, pretend like that mask is like that box over your fingers, and you just have to learn where those keys are. So look up as much as you can and get adjusted more often, and that's going to help reduce some of the side effects of wearing this mask. Thank you so much for watching, and be well.